So the Wellness Centre is a legacy project that came out of the Child and Youth Mental Health and Substance Use Collaborative. And the goal is to have a school-based wellness centre located right in a school and provide wraparound care and services for youth, starting with access to a medical clinic as well as counselling and other programs so that we can offer wellness in the school, as well as provide support and education for parents and for the professionals that work in the school district.
So we actually just started in the spring of 2018. So we caught the last 3 months of the last school year. So this will be our first full year here in the high school.
It is better than we expected. When we proposed the idea, Dr. Currie was at the table and so was the vice principal. And we asked, what would you think about putting a medical clinic or a school-based clinic in the school? And it was a resounding yes. And less than 2 years later, with the help of the Division of Family Practice, we were able to open the clinic, and the response has been beyond what we could have hoped.
We knew that there was a gap in services. We knew that there are a lot of kids using the high school who don't have access to a family doctor, either because of the doctor shortage or because of where they live, sometimes being bused long distances into the school from communities where there are no doctors. But I guess we knew there was a gap. We didn't expect to find a huge chasm, and it's amazing just how big the need was and how quickly the clinic became very busy. Monica and all of our partners created a space that I think the kids are very comfortable using, and I think maybe there's a bit of a generation gap, but I was blown away by how comfortable kids are coming in to talk about their mental health problems. To me, I expected some stigma or some difficulty, and I think the need was there. They're comfortable talking about it, they just needed the opportunity.
Well, one of the golden keys that we have is by having a clinical support in the Wellness Centre while we have the GP in the medical clinic. And we are able to now facilitate an introduction to someone who has a counseling background to talk to them perhaps while they're waiting to see the doctor, or to see the doctor and then the doctor can consult with a counselor. So we were able to actually start that process of wraparound care right at the get-go, and not having to send kids somewhere in the community to find clinical support. And they don't know how to navigate in the community, they don't know how to find these services. We have the services here. And with this wraparound care, our clinical support is able to offer programs and services and even just help them with a coping step plan if they're having test anxiety. So for us, that has been the real gem, is having them right in this space along with the GP.
Yeah, I think as a physician working in our silos in the clinic or the community in our private practice, you occasionally come across students in this age group with this tremendous need, and it's really hard to figure out how to navigate the system for them, in part because the system is complex enough that I think most of us in our private practices don't have a good feeling for how to navigate it. And it's just such an amazing, it's a treat really to work here, not just to know the names of who I'm referring to, but to have them working along beside me just around the corner, to see that wraparound care, to see kids connect with them, and you have that successful back and forth, and you know that they're well looked after and they're receiving counseling. It's quite amazing to see.
SNO's support from day one, from our first ask, has been exceptional, and we wouldn't be here right now today if it wasn't for SNO. Right from the very beginning, when we wanted to do some strategic planning and to actually see, we did some research whether the project was viable and if we had partner buy-in. They helped us fund that research, and from that piece we knew was now in writing, and we had data to support that this project would work. And so from there we've had SNO support in furnishing the Wellness Centre. All of the community partners have come, and they're actually working off the sides of their desks, or not off the sides of their desks, but they're working, they're just mobile. They're moving from their office into the Wellness Centre. But we don't have a really big funding stream, which we're working on. So SNO furnished the medical clinic, and people are just surprised when you walk in there. Like, it's a real doctor's office, and you have it right in a high school.
Yeah, I mean, we needed the support of a lot of partners to make this happen. The school board was a big one, the community organizations that send their staff in to work with us, and even some professionals in the community who volunteer their time. But at the end of the day, without the equipment and without funding for a coordinator, Monica's position, none of this could happen, and we owe that to SNO.
One of the other programs that we offer in the Wellness Centre is the Options for Sexual Health program, and having a sexual health nurse here one day a week has actually been another great gift from Snow. The uptake was a bit slow at first because we are talking about sexual health, but in the last month, she was here April, May, and June, it was great in terms of the number of young people that were being proactive and wanting to look after their sexual health, getting birth control and talking to her, getting counseling on their sexual health. So we're very appreciative of having that program in the Wellness Centre. Going forward, we will still have the sexual health nurse here once a week, as well as we are going to be having LGBTQ plus programming, which we are going to call our Intersectional Pride Project. And Snow is sponsoring that position as well, so they're going to be here twice a month. We're going to have support group for kids, workshops, discussions on diversity, intersectionality, and so we're really looking forward to having that offering that we can have in the school and then take it outside of the school as well. And Snow is also helping us with our backbone, which we call our electronic medical record system, and we do need to have our own internet in the center for privacy and confidentiality, so they'll be helping us with that, and a website. So we're looking forward to having that website, reaching out to the kids, having them one link that they can click on after a visit and give a survey and feedback to how well we're doing or what we need to improve on.
Yeah, I mean, having met face-to-face the students last year and seen what the needs are, I can't imagine Salmon Arm without this clinic moving forward, and I think our job now is just to grow and meet the need that's out there.